Hi team, my name is Jennifer Temby. I'm the RN of the unit and we are here to discuss Ebony and have a post-fall huddle. I want this to be an open dialogue and also a place where we can learn to improve from what happened today. Present for the meeting, I have Elizabeth Moore, LPN, Jerome Higgins, LPN, Amber Lane, UAP, Jeff Golden, UAP, and I invited Barbara McIntosh, social worker. So Ebony was found on the floor bleeding. She fell and she waited about 10 minutes after pressing her call bell. No one came to help her and she had to use the toilet. Unfortunately, did not make it there and fell. Now, I am using the Morse Fall Scale, which is a tool to help assess someone's fall risk. So I want to go over the 6 items that are in this Morse Fall Scale, and I want to explain this to everybody. History of falling immediately or within 3 months is the first item. So Ebony scored a 25 on that. The second item is, does she have a secondary diagnosis? She does. She has diabetes mellitus. So she scored a 15 on that. The third item is ambulatory aid. Is she on bed rest or needs nurse assist? Does she use crutches, cane, walker? Does she rely on furniture to ambulate? I scored her at a 15 because she uses crutches, cane, and walker at home. She did have some falls at home and she was using a cane or a crutch to help her. So I believe that that is what she's used to for her ambulation. The fourth item is, does she have an IV or heparin lock? She does have an IV and it was infusing at the time. So she scored a 20 on that. The fifth item is gait and transferring. Does she have normal bed rest, immobile? Is she weak? Is her gait impaired? She has a normal gait. She was evaluated by physical therapy, so she scored a 0 on that. And the last item is mental status. Is she oriented to own ability, or does she forget limitations? She is alert and oriented ×3. I evaluated her myself. There is no confusion noted. She just is having syncopal episodes, which means she's having episodes of being dizzy. And she's being evaluated cardiac-wise for that. So she scored a 0 on that. Now her total is a 75. Anything equal to or greater than 51 puts her at high risk for falls. So our action should be to implement high-risk fall prevention interventions. So now I would like to discuss a couple of ideas that I have, and we are going to implement these right away. I am also going to send out an email regarding this conversation that we're having. I'm going to assign certain staff members certain tasks that must be done. As always, if you have questions, please come to me right away. Email me, but if it's something urgent regarding this, I need to be notified right away. As I stated just before, we need to implement these right away so we can prevent another fall with Ebony and any other patient in the similar scenario. All right, so things I want to implement to prevent falls and improve from what happened today. We need to have that call bell within reach. She needs to be oriented to the call bell. I know we did this, but we all need to continue to do this in case, let's say she does have a change in mental status. I also want personal items within reach. So if you go in there, you assist her with something, you move something, please put it back within her reach. Also, that call bell needs to be answered within a timely fashion. 10 minutes is not appropriate for her to wait. And now we know she's someone that she's going to get out of that bed. And unfortunately, she had to use the toilet. Understandable. So we need to make sure that we get that call bell time within a good time frame. The bed should be in lowest position, and I'm going to have floor mats put in place on both sides of the bed. When you go in there to assist her with something, feel free to move the bed to the position that's comfortable for you. Again, proper body mechanics, but that bed needs to be lower before you leave the room. So Ebony is a diabetic. She is not on medication. It is diet controlled. However, we should be offering her snacks between meals. She does have nourishments on her care plan. So please make sure someone is doing this. And again, that's something that I will assign to someone just to make sure it doesn't fall between the cracks. Hourly rounding. I will be assigning this to someone. Every hour she should be checked on. and to make sure she is okay. She should be offered if she needs assistance with anything, and we're going to document this. I'm going to put a log in place. So again, I will email and assign this to somebody. Barbara, I want to work with you on moving her room closer to the nursing station so we have quick access and can keep an eye on her better that way. I am going to implement a 2-hour toiling schedule. We previously had her on using the call bell as she was alert and oriented, but I think now that she was getting up to go to the bathroom, a toiling schedule will be better. Again, it'll be 2 hours, and I will assign someone to that. Non-skid socks. They were at her bedside. They need to be on her feet at all times. Please, one of you, go ahead. Actually, I'm going to have Jeff. I would like you to go put them on and just make sure everybody, when you go in there, we check that they're on. Bedside commode. I'm not going to implement this yet because we're putting floor mats, but this is something, just keep in mind, everybody, this is something that we can do if we find that she's more comfortable getting out of bed. I just don't want to do it yet because of her syncopal episodes. I don't want her to get out and fall just trying to get to the bedside commode, but that's something we could think about for down the road. So again, not implementing that. All right, everyone, thank you for your time. Again, I will email all the details to this post-fall huddle, and I will email everyone's assignments. Thank you, and have a good day.